We know Medicare is extremely confusing, so guess what? We are here to make your life easy by making Medicare simple. Every single day you are faced with relentless amounts of advertising begging you to click, call, or answer to something. Yet TV ads can be slick and always misleading. They don't always answer your deep questions about Medicare. As I like to say, they put lipstick on a pig and make you believe you're getting more than the reality. So welcome to Medicare Made Simple, our weekly deep dives, where we will deep dive into questions every single senior has about Medicare. Hi, my name is Kelby Hightower with MedicareHub. I'm the principal broker of an independent insurance brokerage that specializes in Medicare health plans. But most importantly, we specialize in serving others in all that we do. Today, I'll be walking you through a deep dive of all the moving parts of Part A hospitalization coverage. Stay tuned. So to get started, I'd like to make sure you understand the basics of Medicare first. If you don't really understand the basics, you'll learn a ton of important information in the next few minutes. So what is Medicare Part A, hospital coverage, and how do you qualify for Part A of Medicare? If you are like most of us that pay taxes, you've earned your Medicare Part A benefits by paying FICA taxes into the federal government. Or your working spouse, your deceased spouse, or even an ex-spouse has paid federal taxes. If so, you've earned or they've earned Part A benefits by paying into FICA taxes. FICA taxes contribute to your personal Medicare and Social Security benefits. If you've worked 10 years or 40 quarters or longer over your lifetime, you become eligible for Part A of Medicare. When you turn 65 of Medicare, or turn 65 years of age, or you've been deemed disabled by Social Security as well. If you work for cash and you've never paid taxes to Uncle Sam, you'll have to pay a very high premium into Medicare to get Part A. If you have signed up to receive your Social Security to begin the month that you turn 65, you'll find that your Part A will go into effect along with your Part B of Medicare on the first day of that month. So let's take a deeper dive into what Part A covers exactly. So there are basically three main areas that Part A covers. So we will start with the first area today by covering inpatient hospital care. Medicare Part A hospitalization insurance covers inpatient hospital care when all of these are true. First, if you're admitted to the hospital as an inpatient after an official doctor's order which says you need inpatient care to treat your illness or injury. So here's for you men. You've worked all weekend cutting up a small tree that fell in the backyard. Your wife supplied you with glasses of cold water, smiles, and an occasional kiss on the cheek because you jumped on getting everything cleaned up right after the tree fell from the storm. You've noticed you become extremely winded and your chest began to hurt shortly after cutting up the tree. You felt off and just couldn't put your finger on it. So you shared with your lovely wife that you were going to cut it short to catch your breath and relax the rest of the weekend. So guess what? After cooling off, the pain in your chest has remained and you're laboring to breathe. You decided to go to the local urgent care up the street. They do a brief exam, take some vitals, and determine that you're showing definite signs of a mild heart attack. So they call for an ambulance and off to the hospital you go. Upon arrival, they admit you to ensure they can begin taking the proper steps to ensure a solution is found quickly. And guess what? Within a few hours, they determine a stent is needed to help repair a minor blockage. 2 days later, you're released and you're on your way to recovery. This is how you can be admitted in and through a doctor's office or urgent care visit. So this applies to the first thing that I just shared with you. So Medicare Part A hospital insurance also covers inpatient hospitalization care when the hospital you're going to must accept Medicare, or you'll be left paying the full cost of the hospital bill. The doctor that requests an admittance to the hospital would normally know what insurance you have and ensure you're at a facility that is covered by Medicare. So long as the hospital takes Medicare, you're fine. In certain cases, the Utilization Review Committee of the hospital approves your stay while you're in the hospital. They can approve advice on medical necessity criteria and level of care and service determination. Review outpatient observation stays and admissions and continued stays. So basically, when this review committee does this, this is a safeguard to ensure the person needs to stay in the hospital and has been admitted under parameters based on real need. So 20 years ago, a person could almost be admitted based on a flea bite, and it began to drive up costs to the right for you and for everyone. So this was a step to ensure the people with genuine needs were admitted, and all the others could be seen through an urgent care or their personal doctor or a specialist. It just helped lower the costs in creating some managed care models. So I would encourage you to continue on with the next video as I go over the second main area of Medicare Part A coverage, as I guide you through how skilled nursing facilities and that care works. This Part A coverage is one of the most costly services and most confusing to understand. I'm looking forward to helping answer questions that every senior has about this topic. Stay tuned.